Hello and welcome to the Commission on Safety and Quality in Healthcare's Digital Mental Health Standards webinar series. My name is Chris Boyd-Skinner and I am the Project Manager for Digital Mental Health Standards at the Commission. We start by acknowledging the traditional owners and custodians of the land on which we meet today and pay our deep respects to elders past, present and emerging. We also acknowledge the individual and collective those with a living or lived experience of mental health, alcohol and other drug issues. We recognise their vital contribution at all levels and value the courage of those who share this unique perspective for the purpose of learning and growing together to achieve better health outcomes for all. I want to thank all of you who've registered their interest in the standards. We've had over 400 registrations from both Australia and also around the world, so a really warm welcome to all, and we hope that you benefit from today's discussion. Now, over the course of the next few months, this webinar series will see the Commission's team present on topics including privacy, information and cybersecurity in digital mental health, partnering with consumers and service users, and also take a deep dive into both clinical and technical governance for digital health. Stories from people with lived experience of mental ill health and managing to use digital mental health technologies. Today's webinar, Understanding, focus on providing a background to the standards. We'll also have an opportunity to discuss their importance in providing safety and quality in digital mental health services. We'll provide an overview on the assessment and accreditation process, and we'll also hear some unique perspectives from a panel of digital mental health service providers on some of the benefits and also some of the challenges of implementing the standards. Towards the end of today's session, there'll be an opportunity to use the moderated Q&A function to pose any questions or comments. We've also received several questions via the registration portal and we'll attempt to answer these first, and any remaining questions will be answered via an email after the event to our participants. And finally, a recording of this session and the accompanying slides will be made available on the Commission's website after today. So if you'd like to go back and review the discussion or the content, it will be there as a reference point for all of our attendees and also your colleagues. I'd now like to introduce our speakers for today, Dr. Victor Storm, Senior Clinical Advisor for Digital Mental Health at the Commission. We're also joined from the Commission as well by Ms. Sandra Rigby, Project Officer for the Digital Mental Health team. We have Dr. Cathy Kezelman, Blue Knot Foundation President and Executive Director, Mr. Chris Rule from the Black Dog Institute, who's the Manager for Quality Assurance and Service Implementation. And finally, we're joined by Dr. Kylie Bennett, ehub Health's Managing Director. It now gives me great pleasure to call on the Commission's Senior Clinical Advisor for Digital Mental Health, Dr. Victor Storm, to provide some background on the National Safety and Quality Digital Mental Health Standards. Thank you, Dr. Storm.
Thank you, Chris. On the digital mental health landscape in Australia. Digital mental health services offer new and innovative ways to access mental health services and have seen strong growth over the past decade. These services can be used as standalone supports that are self-managed or therapist-guided, or as a complement to in-person services. In some circumstances, digital services may be easier to access than in-person services, and sometimes can be used anonymously to protect service user identity, which may encourage fuller disclosure and engagement. There is growing evidence about the important role digital mental health services can play in the delivery of services to a wide variety of consumers, carers, and families. Younger people are often seen as the main users of digital mental health services, but as our population becomes increasingly familiar with digital technology, age and disability are not necessarily barriers to the use of these services. Some digital services have been evaluated and shown to be as effective as in-person services, while others have not been subject to rigorous evaluation processes or evidence collection. It is for this reason that standards become increasingly important as a way to ensure services reduce the risk of harm to the people who use them. The Commission has a long history in developing and implementing safety and quality standards. Standards provide a tangible framework to support safer care, high-quality service provision, and above all, protect people engaging with healthcare services from harm. The development of the digital mental health standards has been a journey of almost 5 years for the Commission. The project to develop the standards is funded by the Australian Government Department of Health and Aged Care and offers an opportunity to support service providers to manage safe digital mental health services and provide service users with confidence and assurance that the digital mental health technology they engage with are high quality. The digital mental health standards were launched in November 2020. They were developed in partnership with service users, clinical and technical experts, mental health clinicians, and service providers. The standards are voluntary. However, the benefits of implementing them include greater public trust and uptake of digital mental health services and enhanced empowerment and choice for service users. The digital mental health standards are modelled off the National Safety and Quality Health Service, NSQHS, standards. However, they include a range of new actions that are suited to digital mental health services and also acknowledge the online environment to which they apply. The standards complement existing regulatory provisions that apply to digital mental health services, including consumer law, privacy, and health records law and principles, health practitioner registration, and regulation of medical devices, including software that meet the definition of a medical device. Overall, the standards provide a nationally consistent statement about the standard of care service users and their support people can expect from a digital mental health service. The three standards that make up the digital mental health standards include clinical and technical governance, partnering with consumers, and model of care. The clinical and technical governance standard describes requirements for the clinical and technical governance of services. Elements include safety and quality systems, workforce qualifications and skills, and the safe environment that is required to maintain and improve health outcomes for service users. This standard also focuses on privacy, transparency, security, and stability of digital systems. The Partnering with Consumers standard describes the systems and strategies to create a person-centered digital mental health service. This is a service in which users, and where relevant their support people, are involved in shared or supported decision-making, become partners in their own mental health care, and are involved in the development and design of quality digital mental health care. Finally, the Model of Care standard describes the processes for establishing and delivering the model of care a service provider offers. It focuses on minimising harm, communicating for safety, and recognising and responding to acute deterioration in mental state. Over the last 2 years, the Commission has been supporting service providers to implement the standards. We have also piloted them with a range of service providers to assess their suitability in a real-world setting. This was achieved by using a self-assessment tool to prepare service providers for a pilot accreditation assessment, which then allowed us to develop and refine an accreditation model. So, what type of services are in scope for the standards? Under the definition in the Digital Mental Health Standards, a digital mental health service is defined as a mental health, suicide prevention, or alcohol and other drug service that uses technology to facilitate engagement and delivery of care. This includes services providing information, digital counselling services, treatment services including assessment, triage and referral services, and peer-to-peer support services. Different modalities can be used to access a digital mental health service. These include the telephone, including mobile phones, video conferencing, the web, including web chat, SMS, or mobile health applications, also known as apps. Digital products that are not used directly to facilitate engagement care do not meet the definition of a digital mental health service used in these standards. This includes standalone or medical records, decision support tools for clinicians, analytic services, services that primarily provide support and education to health professionals, clinical practice managed software, and clinical workflow and communication software. These services support a range of service users. However, the standards have a particular focus on ensuring that services are accessible and suitable for Aboriginal and Torres Strait Islander peoples, culturally and linguistically diverse peoples, and people from LGBTQI+ backgrounds. Technology is not slowing down, and there continues to be a significant increase in the number and types of digital mental health services available in Australia. And while the digital mental health standards are voluntary, they provide an opportunity to support improved safety and quality of service provision for people engaging with mental health care online. Thank you.
Thank you, Dr. Storm, for that overview and summary. And for those wanting to learn more in relation to the background and the development of the standards, please head to the Commission's website and the Digital Mental Health landing page for more information. That's at safetyandquality.gov.au/DMHS. It now gives me great pleasure to bring back our invited guest for a panel discussion and to hear some first-hand insights into how implementing the digital mental health standards led to some challenges and also a number of benefits at the organisational level. For background, each of the organisations that our service providers represent were involved in the pilot implementation of the standards back in 2021. And they have experience in implementing some or all of the actions which make up the digital mental health standards and have also been through a mock assessment process in the past. And the services all are different in terms of their size, their scope, and the types of digital mental health tools and services they provide. So we do have quite a nice cross-section of diversity in that sense. So welcome back, everyone. It's good to have you with us today. Dr. Cathy Kezelman, if I could start with you. I wanted to just touch on what some of the positive impacts on Blue Knot Foundation's service delivery have been since that implementation pilot back in 2021.
Thanks, Chris, and thanks for including us. So, look, there's a number. I'll go through them. While the culture of continuous quality improvement is inherent in Blue Knot, the pilot did identify the need for a comprehensive quality management system, a better documented internal audit system, and a more robust risk management framework. So we're going through a current board strategic planning process, and that's prioritising these gaps, with the implementation being driven by the executive and leadership teams underway, and strategies to further engage service users in service delivery and design being enacted. So while our clinical and IT teams have always collaborated well around technical enhancements, responding to the needs of service users and staff, we're formalising these processes to strengthen both clinical and technical governance. The pilot also flagged issues with quality and integrity of our data within Salesforce, which is a really powerful tool. But now we question our data more. What do we collect and why? How does data map to client journeys? How do we triangulate data, collect quantitative as well as qualitative data, consider trends and interdependencies? So a high confidence in data quality and integrity will position us better to optimise the delivery of safe quality services to our callers. So for any initiative, we're now considering what to measure, why and how, and we're consulting across the organisation to determine the actions needed to strengthen any processes and internal capabilities which are not best quality. And in so doing, we're focusing on high-value actions which solve multiple problems and consider their ease of implementation as opposed to their benefits.
Thanks, Cassie. Lots to unpack there, but one thing that definitely emerged was this idea of governance and how we achieve good governance. We know that by and large is a key feature of delivering high quality services. And I think regardless of whether it's a face-to-face or a digital service, that concept of good government really should be embedded across all of healthcare. Can you tell us a little bit about the role of Blue Knot Foundation's board since the pilot, and why was it important to get buy-in from the executive as part of that process?
Sure. So it's timely in that our last 5-year strategic plan finishes this year. And so the board is currently developing a new strategic plan, which has a key focus on clinical and technical governance as well as risk. We've recruited several new board members with expertise in these areas specifically, and we're also reformulating our clinical and technical governance committee with their framework to be informed by data areas highlighted through the pilot. Data is showing us where to look and enabling us to ask different questions. We're setting up more robust governance frameworks and considering the roles of governance in IT, particularly cybersecurity, including progressing the embedding of the Essential Eight. For example, restricting unauthorised software, malicious programs, tightening security controls, safeguarding against account misuse. We're also considering our suppliers, screening subcontractors around the efficiencies of their products to seek an assurance that our contractors do the right thing as well. So the executive sees this as an opportunity to help progress safety and quality issues which have previously been tackled but not fully resolved. It's also critical for the board and executive to be aligned, and the regulatory requirements within the standards provide an objective standards to rally the organisation at board, executive and operational levels. Executive buy-in is additionally critical to drive implementation and bring teams and staff along on the journey.
So some pretty substantial changes there by the sound of things, and it cuts across the whole organisation for certain.
That's it. The whole of organisation exercise.
Indeed. Now, we know that Blue Knot Foundation undertakes lots of different activities advocate for people who've experienced complex trauma, which is, of course, a very important part of the mental health care system in Australia. Some of the things that you do in terms of your organisation is developing up resources. You run a lot of workshops, do lots of fundraising activities, as well as offering a phone counselling service. So I'm wondering if you could perhaps describe how working with the digital mental health standards is being integrated into the running of your organisation as a whole.
Yeah, so the digital mental health standards have been a catalyst for a change management process within the whole of Blue Knot, within many of the elements previously on our radar. Over the last 2 to 3 years, organisationally, we've implemented and integrated a range of new systems and activities inherent in the standards, and the standards will help us extend this further. For example, using the standards lens has enabled us to identify staff across the organisation who need additional support and supervision to meet the benchmark needed for the whole team to best respond to client needs across a range of services. As a critical first step, we've invested in quality and safety specialists within the organisations overall, as well as within the helpline. As a leader in trauma-informed, person-centred best practice, safety and quality are at the forefront of everything we do. The standards provide the structural mechanisms and processes to enable us to integrate these principles further into our policies, processes, services and systems across the organisation. To inform this, we're moving to a more active co-design process, building partnerships with service users and with lived and living experience organisations. This will enable us to use more client surveys and proactively seek client feedback in real time to allow us to identify and intervene in any issues early to minimise adverse outcomes. This will be applied to our workshops for survivors and supporters and inform the development of tools and resources, as well as on our helplines. This is and will continue to be an iterative change process. We're not there yet, but we're on the journey. Process is client-led, top-down, bottom-up, and always focused on empowering recovery for people impacted by complex trauma.
Thank you, Cathy. Some wonderful insights there, and great to see some of the changes that have come into effect since going through that process last year. And we wish you all the best, of course, with implementing the standards and moving towards accreditation. Dr. Kylie Bennett, we might bring you in now, and we're interested to hear from you today as the co-founder and managing director of ehub Health. We know that good documentation practices are really crucial across all healthcare settings. And we're wondering if you could tell us what you changed about your documentation processes as a result of implementing the standards.
Hi, Chris, and thanks for the invitation. I think documentation for me is kind of the story of the standards, right? What I learned was that if it's not documented, it doesn't exist. Now, I thought we were doing a lot of things really well, and we were, but they weren't necessarily documented. And so that's the big thing that we've had to change. So I'm not just talking about policies, but also procedures. And we now have a huge suite of documents With that, of course, then comes a whole lot of challenges because a document is not of great value if it's not kept up to date. So then we need systems and reminders and review dates and ways to ensure that we actually keep all of our documents up to date, which of course means that we're then reviewing what we're doing on a regular basis, and hence the value of this aspect of the standards as well. I think another aspect of documentation is that you have to find a system that works for your organisation and how you operate. Assuming that some big managed system that a huge corporate might use would work in a smaller setting is not necessarily the case. So there's been a little bit of trial and error within our operations team in terms of how we do this effectively. But yes, documentation, as I mentioned, is to me the story of the standards.
Absolutely. Now, ehub is a smaller digital mental health provider, and that probably applies to a lot of people that have joined us on the webinar today. A lot of services joining us from similar size organisations. Could you tell us how you implemented processes such as setting up a safety and quality committee with only a limited number of resources?
Yeah, and this for me has been a big learning. I kind of thought that governance had to include quite a lot of people, and that I would be, to put together a safety and quality committee, I'd need to be kind of recruiting people and working out how to pay them for their time. And although we were already getting the technical and clinical expertise we needed, I wasn't really sure about how to put that together. And as I've explored and got advice, I've realised that governance doesn't have to necessarily mean lots of people. So, for example, our safety and quality, it's called a safety, quality and technical committee. We also have a clinical governance committee, but that safety, quality and technical committee only has 2 people on it who have consumer lived experience, technical expertise, and can tap into a whole lot of other resources as needed. Now, that committee has a very clear terms of reference that's endorsed by the board, and they meet monthly, and they also report to the board regularly. So what we now have is a very clear structure of governance with clearly defined roles and responsibilities that works. It's fully documented, I'm very pleased to say. But more importantly, that committee meets monthly and discusses all of the things that need to be discussed and then reported, escalated as needed. So I think for me, I've realised that one of the benefits of setting up these kind of systems is that you then have access to a lot of information very quickly. So for example, if I needed to know on a monthly basis how many service user feedback items resulted in a quality improvement task, I've got that. We review that every month. If I wanted to know how many incidents of a certain type had happened, luckily not many, but if I needed to know that, I could have it in an instant. And that's the sort of information I can then report to the board, which then also creates a lot more accountability for the board when they're getting that information and they're seeing all the quality and safety issues and their responsibilities at every meeting reported to them. So overall, it's been a very positive experience. It was just working out how that can actually be achieved in our very small context.
Yeah, you've definitely demonstrated how you can do more with. Now, your service also focuses on providing anonymous and automated self-help as one of the offerings. Could you share with us how the focus of the Partnering with Consumers standard can be addressed by services such as yours?
Yeah, this is another one we found a little bit tricky. So our services are really about, as you said, anonymous use where possible, people dipping in and out of the services. We really don't want to collect much information about them if possible. They're also automated and very historical. They have a huge evidence base. They were mostly, sorry, that's my dog, created 15, 20 years ago. We don't change them often, and that's part of why they're so successful is they have this big evidence base. So a challenge has been, how do we actually create a consumer engagement framework that works for that situation? We don't want to be bringing together service users and identifying them necessarily. We're not doing a lot of current program development or co-design as it's currently understood, even though we did, of course, have a lot of consumer involvement at the time of design. So what we've done is really focus on a couple of things. The first is expanding the information we give to service users and the community and health practitioners. So making sure that we're more transparent. So giving information about governance, about our strategic direction, about how we evaluate our programs, about what kind of feedback we get about our programs, some stuff that we hadn't been previously reporting to service users. And then whenever we do that, we're also providing an opportunity for whoever's reading it to provide feedback, so that we are actually always asking, is this useful to you? Do you have anything to add? What should we be doing differently? So I think that's a really important aspect of it. We also continue to always ask for feedback about the experience of service users of our programs. We've always done that, but we've expanded that. So we're now, for example, asking about, was our privacy notice easy to understand? Did you have any contact with our support team? And if so, was that a positive experience, or do you want to explain anything about that experience? So we're really trying to expand the areas in which we actually seek feedback. And then the final thing we've done is we've created, I'm not sure yet whether it's going to work with our service users, but we've created a consumer advisory group where we've invited service users, if they want to register with an email address. And when we get to the moment of actually designing a new service or a major quality improvement exercise, we'll then be inviting them to, in an electronic, anonymous way, actually have input on that process. So we'll see how that goes. But yeah, it has been a little bit of a challenge, just trying to think of things from a different perspective than potentially getting 10 people in a room and talking through and getting their opinions on how we do our governance, for example. So it's been an interesting process.
Oh, great to hear. And lots of opportunities by the sound of things to really embed that consumer voice into everything you do in your organisation. And it's great to see. Now, Chris Rule, we might bring you in now. And we know that the Black Dog Institute has many, many years of experience as a leading mental health research institute and also a provider of resources. Just wondering if you could describe the key benefits you see in implementing the digital mental health standard.
Sure. Thanks, Chris, and hi everybody, and thanks for having me. I think for me, even as a big organisation, a big medical research institute, lots of the things that Kylie and Cathy mentioned were relevant to us too. I think we learned a lot through working through the framework, and I think it's really improved, I guess, the rigour in which we go about ensuring safety and quality. I think for us, the thing that the framework has done that has been really powerful is it's helped package up how we approach safety and quality. What we found as we worked through the assessment was that, the vast majority of policies and procedures and ways of working, were mostly in place. The things sort of happened quite despondently. Different teams are responsible for different things, and we weren't necessarily looking at safety and quality as a whole and looking at how we sort of connect all the dots and make sure that we're doing this in this sort of, consistent and, comprehensive way. And I think the framework's really helped achieve that. I think it does what good frameworks do, and it provides that structured approach to how you go about doing something and ensuring you're doing it well. I think the other key benefit for us, is a medical research institute, because the nature of research projects, you have ethics and all those types of things involved in your design and development. But I think there was a little bit of a gap in us carrying that level of rigor over to how we then supported our publicly available apps and websites. So I think that's, again, really prompted us to look at how we're going about, ensuring transparency of product information and privacy collection notices and all that sort of detail and information you make available to consumers. Also made us really think about how we ensure we continue to engage with consumers, even and people with lived and living experience, those people who are using our digital products once they are released and accessible to people out there in the public. So look, I guess to summarize, for us, it's really provided that structure, and it's also in a way prompted us to think about safety and quality as an organization more broadly. And my role, my previous role was focused on e-health implementation, and it's now been broadened out to focus on safety and quality as it applies to all of our publicly available products, services and programs. So I think it's just really reiterated to us the importance of safety and quality, from research right through, and ensuring that continues.
That's great to hear. And I just wanted to pick out a comment that you made there. We talked a little bit about privacy and information. We know that that is an ongoing challenge for all service providers, not just in digital mental health, but across the board. Could you talk a little bit about how Black Dog ensures that its privacy and information security processes are firstly up to date, and how do you ensure that they're effective in terms of your service provision?
Yeah, that's an interesting question. I guess there's going to be some variation for service providers there in terms of what level of involvement they have with managing and developing digital products. But I think the biggest piece of advice I can give here is to ensure you have the right expertise involved. Really from a legal and technical perspective. And that needs to start from that design and development phase if you're looking at producing something new, and then how you continue to involve that level of expertise ongoing. I mean, at Black Dog Institute, we're fortunate to have an in-house IT development team in place. And as an affiliate with UNS of University of New South Wales, we're able to draw on their systems and policies and procedures in terms of data management and security. But in the absence of having in-house development teams, who can help you navigate the world of web or app development and management, and hosting and data management and all those sort of things, I guess I really just would encourage people to work with trusted and reputable providers. All providers should be forthcoming in terms of data security and management, and what they can offer you is when you're working in this space. And I think you should be asking questions. In terms of, Black Dog Institute hosts the data that we collect through our applications. So we have what we refer to as our research engine, and obviously that prompts us, and we have policies and procedures in place around how that data is managed. We have critical incident response plans in place and so forth. But I think the key is making sure you've got the right expertise involved. Seek that advice from legal teams, from technical teams, and work with reputable providers, I guess, is my advice there.
Using that as the foundation for everything to spring out of.
Sure.
Now, Kylie touched a little bit on embedding that lived experience voice into service provision. And one of the interesting things from us at the Commission that we discovered through the pilot implementation was Black Dog's lived experience framework. So I'm wondering if you could just tell us a little bit of background on the framework, and perhaps touch on how it was developed and how it was implemented in practice.
Sure. As I mentioned, Black Dog Institute's a medical research institute, so we have lots of projects going on, constantly. So, ensuring that we engage well with people with lived and living experiences has always been important to us. At BDI, valuing lived experience, it sits at the heart of our organisational values. So that's where it starts, and having that as one of our organisational values really helps define the way we work at BDI. And at the end of the day, I'm sure everyone listening today would agree that engaging with people with living experience of mental ill health is critical and important to the work that we do. It's proven that better outcomes are achieved when we work with those that will be impacted by the work we do. And at the very least, I would say it makes sense. With valuing lived experience at the heart of how we work at BDI, there's been some pretty significant commitment from the organisation to ensure this translates into meaningful actions and direction on how we do things, so how, in terms of what it tangibly looks like. That said, there's a small but dedicated team who, in partnership with lived experience advisors, guide the implementation of our framework that we've had produced. In terms of what this looks like in practice, our framework is clear in regard to what lived experience participation must look like, and it also sets up our position in terms of how people should be involved meaningfully and effectively. At Black Dog Institute, we do very much lean towards co-design, so really involving people from the onset and having clear roles and responsibilities established, having people involved in decision making and having real power in influencing the direction of projects. We also, within the framework, we have a range of guides that are available to project teams, and I think this has been really important. And I've heard this a lot from our research teams and development teams. It's one thing to, I think we can all agree that involving people with lived and living experience, those people who are going to use the things that we're producing, that makes sense. But I think a lot of the time it's difficult for people to know what that tangibly looks like. So we do have guides and checklists that project teams can work through to really, at the beginning of the project, really explore what level of involvement is going to work for that project. Do we have budget to remunerate the people that we want to involve? What level of decision-making powers do we want to share? How will we keep those people involved and informed, throughout the project? So I guess first and foremost, I think in the work that we're all in, it's important to really value lived experience, and I really love that at Black Dog Institute we have it as one of our values. It's really does sit at the heart of how we approach the work that we do, and I think the next thing there is really either setting up some of those tools that your project teams or your research teams can work with, or looking to those bodies and organisations that can provide some advice and direction, or share the learnings in which how they go about doing things. And I was actually speaking to our lived experience team, this week, and they were, and I was checking in with them about whether or not it would be okay that I would share their details, for others to engage with them and find out a little bit more about how they go about implementing the framework that we have, and they would be happy to, field questions and provide some help and support to other services and organisations. So yeah, I think the framework's been useful. Like the NSQ DMH standards that we're talking about now, I think it provides that structure, and I think the structure is important because I think it can get a little bit lost in terms of how to engage meaningfully with real people. So I think the framework provides that structure, and I think the guides then in turn provide that tangible direction and advice to project teams on how to do it well.
Wonderful to hear, Chris. Thank you so much for sharing those thoughts and insights. And again, to all of our speakers on the panel today, and it's really encouraging to get a sense of what's happening on the ground in terms of implementing the standards and definitely seeing some of the results. So thank you very much. And we'll bring you back at the Q&A section at the very end of the presentation today. So we now turn to talk about assessment and accreditation to the standards, and also the process for service providers who may already be thinking about or have started implementing the standards, or potentially those preparing for an assessment with an accrediting agency. So the process of accreditation really provides assurance to the community that healthcare services meet the expected standards for safety and quality. Accreditation is very much a formal program where trained independent reviewers assess evidence of implementation for a specified set of standards. And in this case, we're talking about, of course, the digital mental health standards. And the Commission has responsibility for both formulating and administering model national accreditation schemes for healthcare services that relate to healthcare safety and quality matters. And this involves a number of elements. The Commission are responsible for formulating rules for the accreditation scheme. They also provide oversight to the accreditation process through their approval of accrediting agencies and also managing those accrediting agencies' performance. We also work to ensure consistent high quality assessments across accrediting agencies who are approved to conduct those assessments. And the other key component here is evaluating the effectiveness of accreditation schemes using the assessment outcome data that we collect routinely as part of accreditation. So accreditation to the digital mental health standards falls under the Australian Health Service Safety and Quality Accreditation Scheme, or the ASQA scheme. And the ASQA scheme was set up by the Commission some years ago, and a number of Commission standards, including the NSQHS standards and the multi-purpose service module, which some of you may be familiar with, and then also the National Safety and Quality Primary and Community Healthcare standards also apply to the ASQA scheme. So on the 1st of November this year, 2022, the scheme for the digital mental health standards formally commences. And so from this date, digital mental health service providers can contact an accrediting agency approved by the Commission to commence that process for assessment and gaining accreditation. Now, accrediting agencies provide the mechanism by which digital mental health service providers are assessed to the digital mental health standards. And these agencies are approved by the Commission to operate in the accreditation scheme. And they also sit independently from the Commission as well. The accrediting agencies very much go through a rigorous approval process in order to provide assurance that they can appropriately assess service providers. And this includes a number of steps. There is an application process where agencies provide evidence of their policies, processes, and the workforce who will undertake the assessments of digital mental health providers. There's also a compliance check where the Commission ensures they meet a number of specific criteria, and then they participate in a panel interview to discuss their application. Now, a list of agencies who are approved to assess against the standards can be found on the Commission's website, so head to the Digital Mental Health landing page for a list of those providers and also their contact details. Now, a key step for service providers either thinking about or preparing for accreditation is the process of self-assessment. Self-assessment allows providers to understand the types of evidence required to provide to an accrediting agency in order to demonstrate conformance to each of those individual actions in the standards that Dr. Storm pointed out earlier in the session. And the Commission's developed a self-assessment tool to track progress on implementing the standards. And this is a really useful starting point for those that are beginning their journey towards implementing the standards. Self-assessment can largely be used to identify areas of your service that already meet the requirements of the standards, and also for services wanting to undertake more of a gap analysis to see where improvements might be required to their safety and quality systems. So we'll now take a look at the assessment process for service providers, and there's 12 individual steps in the assessment process for those seeking accreditation to the digital mental health standards. The 12 steps in this process fall into a number of phases. The first phase is the application and engagement phase, where a provider engages an accrediting agency. We then move through to the assessment and remediation phase, and this is very much the practical aspect of the assessment process where evidence needs to be provided and also demonstrated by a service provider to an accrediting agency. And then we move to the final phase, which is outcome reporting and monitoring. And this phase really clarifies the assessment outcome and steps out those requirements for maintenance of accreditation for the remainder of the accreditation cycle. So let's dive a little deeper into each of these steps. The first step, the application, of course, includes a provider making an application to one of the approved accrediting agencies for the digital mental health standards. And the application requirements may differ slightly from agency to agency, but generally it involves arrangement with the accrediting agency to undertake the assessment. The scheduling component involves clarifying the practical elements of the assessment, like the assessment date or the timelines will be in the lead up to that assessment, and then other arrangements, for example, the technical platform or video conferencing software that might be used to conduct a virtual assessment. If the service provider believes that some actions in the standards may not apply to their service type, they'll go through a process of justifying to the accrediting agency why each action is not applicable, and they would provide evidence to support that request. We then move to the assessment phase. The initial assessment comprises of 2 steps: a desktop review, where the service provider submits their evidence to the accrediting agency to demonstrate how they meet each of the actions in the standards. And that could be in the form of policy documents, role descriptions, or risk management plans, strategic documents, or the like, and they would need to provide those to the accrediting agency ahead of this second phase, which is the verification step. So once those documents have been submitted and reviewed by the agency, the verification step follows, and this can be conducted either on-site or virtually, and provides the organisation with an opportunity to demonstrate their safety and quality systems to the assessors. When the initial assessment process is complete, the agency will prepare an interim report on the performance at the assessment and provide this to the service provider within 5 business days. This report will include a rating for each of the actions in the standards as either met with recommendations, or not met. Now, if a provider has a number of met with recommendations or not met actions, they have a period of 60 days to address those areas. And if required, the accrediting agency will then re-engage the service provider for a final assessment in order to address each of those actions requiring remediation. We're then entering the final phase of the assessment, and the agency will determine an outcome based on that final assessment report, and they'll deliver a final report within 30 days to the service provider. The accrediting agency then submits data to us here at the Commission on the outcomes for the assessment, And then the Commission will register the service provider as to whether or not they are accredited or working towards accreditation. Now, accredited means that all actions are met satisfactorily within the standards, or a working towards accreditation rating means that a provider has met at least 50% of the actions in the standards and can then continue to work towards meeting within the next 3 years of the accreditation cycle. A provider can only be awarded working towards accreditation once, and after this, they must meet all 59 actions at their next assessment in 3 years' time. And then for the remainder of the 3-year accreditation cycle, providers will continue to maintain their safety and quality systems and then apply for reassessment towards the end of their 3-year cycle. So to summarise that process, the journey begins with self-assessment. It includes a desktop review of evidence to meet the actions in the standards, and then includes a demonstration and a verification process of the provider's safety and quality systems. And that would result in either an award of accreditation, working towards accreditation, or not accredited. And so this process, along with all of our implementation resources, are available on the Commission's website. And we'll now hear from Sandra Rigby, the Commission's Digital Mental Health Project Officer, who will take us through a range of implementation resources developed to support digital mental health service providers implementing the standards. Thank you, Sandra.
Thank you, Chris, and welcome everyone. The Commission has published a range of resources to support service providers to implement the standards and understand the accreditation process. We're also developing new resources to be released very soon. In this presentation, I'll introduce you to some key support tools. All our resources are published on our website in the Digital Mental Health Resource Library. Our resources include the Guide for Service Providers, fact sheets, action guides, the self-assessment tool, and the mapping tool. And I'll introduce each of these in turn. So the Guide for Service Providers is really the foundation from which all our other resources are built. We recommend it as the starting point for anyone who wants to understand the intention of the standards and how they should work in practice. The guide was developed through extensive consultation with service providers, consumers, clinical and technical experts. The guide explains the purpose of each action in the standard, how they should be implemented, and the kinds of evidence a service provider can use to demonstrate conformance to the action. It also includes links to further resources, including toolkits, templates, and useful websites. Our next foundational resource are our fact sheets. These provide a clear and concise outline of key topics, which include an overview of each of the 3 standards, a short guide to the assessment framework, and tips on how to conduct a self-assessment and undertake a risk assessment. Further fact sheets will be released soon. Complementing the fact sheets are our action guides. The action guides take a hands-on approach to areas that may pose particular challenges in the standards, as we've heard from our service providers today. So these could include privacy, governance, and partnering with consumers. The guides were developed from interviews we conducted with a range of service providers of varying types and size. Based on these discussions, the action guides focus on strategies and practical advice for successful implementation of the standards. The action guides include direct quotes from service providers as well as consumers, practical tips and strategies, links to useful resources including government guidelines, policy and information, and a summary of the key barriers to action and enablers to help service providers find solutions and positive outcomes. We expect to publish the action guides at the beginning of November, and publication will be promoted via our social networks and direct mail. The Commission provides a self-assessment tool on our website, and as Chris explained, this is designed to help service providers check how they are currently aligning with the standards and the steps they need to take in order to be ready for formal accreditation. We've provided a fact sheet and a how-to guide explaining step by step how to use the self-assessment tool. A new self-assessment tool is currently in development, which will have a more user-centric interface and will allow services accredited to other standards to check their alignment. We expect this to be available in the first half of 2023. We recognise that a number of services seeking accreditation to the digital mental health standards may already be accredited to the National Safety and Quality Health Service Standards, the NSQHS. To help this process, we've produced a map of the digital mental health standards to the NSQHS standards. This shows how the standards relate to each other and identifies the actions which are unique to digital mental health and where a service may need to focus their implementation efforts. The document lists all the digital mental health actions in full and the corresponding NSQHS action showing if there's a full match, a partial match, or no match. It's colour-coded using purple for digital mental health and blue for the NSQHS, and it's clear, concise, and easy to use. Further mapping is planned in the future to show alignment across other standards, including primary and community healthcare. You'll find all of our resources in our resource library on our website, safetyandquality.gov.au DMHS. Thank you.
Thank you, Sandra, for that overview and showcasing some of the implementation resources that we've developed up as part of this program of work. And as Sandra mentioned, we'll have a number of new resources coming online in the next few days and also into 2023. And so please stay tuned to the Commission's website. We now have our final section of the webinar today, which is an opportunity to answer some questions sent in via our attendees and also those submitted in the Q&A function in the portal. So please, if you have a question, feel free to drop it into the Q&A tab and we'll do our best to address it before the end of the session today. If we don't get to answer all the questions, we'll send an email out and keep a log of those that have been submitted today, just to ensure that you get the information that you need. Alternatively, any other questions about the standards or accreditation can be forwarded to our inbox, dmhs@safetyandquality.gov.au. Welcome back to our panel of speakers, and we'll start with our first question, which is a question to the panel. We're wondering what the biggest challenge for your service was in implementing the standards. Kylie, if we could start with you first up, that'd be great.
Yeah, sure. I think that for us, the biggest challenge was understanding how each component of the standards applies to us. So, there's a lot of different kinds of digital mental health services. The Commission's done a great job of trying to ensure that the wording of the standards is as generalisable as possible to the different kinds of services, but it still can be difficult to work out exactly what that means when you're not in a hospital setting, for example. And particularly for us as a very small organisation, what does this mean in practice? So, but I must say that the Commission's resources have been fantastic, and the Commission is also very open to discussions and explanations about what this could mean in different contexts. So once we kind of grappled with that, it's been onwards afterwards.
Great, thanks, Kylie. Cathy, I might move to you. Any significant challenges that you might like to have for our listeners today?
Look, for us, it's really been the scope and the scale of the work, in addition to the amount of work a small organisation has on its plate. As we know in this sector, we often, have multiple competing demands. And while the board and executive leadership may understand the benefits and the process of the standards, it's about how we manage that process very gently and cautiously and step it out with the team, because the last thing we want is the team to be overwhelmed. And so it's a very careful change management process whereby we don't introduce too much complexity within too short a time frame. But really highlight the benefits, because we're, as an organisation, we're fully embracing the standards, but we need to filter that right through that as well.
Thanks, Cathy. We might move to you, Chris. Would you like to highlight a couple of challenges?
They've been mentioned. I think what Cathy just mentioned, the challenge for us, was really the scope of what's involved in it, even undertaking the assessment and then responding to any gaps you have. And I think for us, in terms of overcoming that, it's really about, you need to approach the assessment process as a project in itself, and ideally being able to dedicate some people to working on it in a recognised way and setting it up as a project from the beginning. It's not, I would say it's not something you can just, complete in the spare minutes that you have in the day. I think having people dedicated to working through it is going to be important. And then recognising that there may be some challenges in terms of rolling out new policies and procedures and ways of working after you've worked through the assessment if you do have gaps. So yeah, the challenge is definitely the time involved, but time well spent. I would say I would still agree to that 100%.
Great, some good thoughts there, and thank you for sharing. We had another question come in during the registration period, and the question was, is this standard going to be compulsory for mental health service provision / providers? Now, to answer this question, as we mentioned over the course of today, the standards are for now voluntary. They're a new set of standards, and digital mental health is an emerging area, so voluntary works quite well to support service providers to implement and come along on the journey. So there really is no short or medium-term view to making them mandatory at this stage. Now, another question that's come in, I guess, stems from some of the conversation we were having around lived experience earlier in the panel discussion. How do you see the role of the consumer carer lived experience representative in accreditation? I guess the way that we would answer that is that partnering with consumers really is a key component of the standards. There's by and large an expectation that services are expected to demonstrate how they involve service users in the design, development and evaluation of their digital mental health services. So as part of being the assessment process, accrediting agency assessors may actually speak with service users if it's deemed appropriate. So there's lots of different elements of the accreditation scheme that focus on the consumer perspective. And we'll have a little bit more to add early next year with a proposed consumer campaign that will really sort of highlight how we bring that lived experience into digital mental health service provision. I might throw to Dr. Storm for the next question. Dr. Storm, there was a question that came in asking whether the standards were developed for public facilities assessed against the NSQHS standards under the umbrella of health service organisations.
Yes, thanks, Chris. Look, we're certainly healthcare facilities who are accredited to the NSQH standards are also seeking accreditation to the digital mental health standards. And as Sandra Rigby outlined, the mapping tool describes which actions may need additional attention beyond those which directly fully align with the existing NSQHS. The 18 actions for which there is no direct match out of the 59 are actions which are primarily technical in nature. So this includes elements such as privacy, information security, and cybersecurity. So once released, the mapping document will be a great guide for health services to see what additional steps are required to meet the digital health standards. But where there's a direct map and they're already accredited against the NSQHS standards, they are accredited. Thank you.
Thanks, Dr. Storm. We've got 1 minute left. We may be able to squeeze in a final question, so I might throw this one to you. What support does the Commission's digital mental health team offer for accreditation?
Thanks, Chris. We direct you to a resource library. We've got lots of resources for service providers, also some for consumers and general advice, and we strongly recommend the Guide for Service Providers as a starting point. We also have an advice centre. You'll find the contact details on the website, so you can both email and ring the advice centre for specific advice. We're very happy to also answer queries via the DMHS direct email, or we're happy to discuss. So please don't hesitate to reach out, and we're very happy to schedule a time to discuss questions and problems in detail.
Thanks, Sandra. And that unfortunately brings us to the end of today's session on the National Safety and Quality Digital Mental Health Standards Understanding Accreditation webinar. So on behalf of the Commission, I'd like to thank our panel of guest speakers for sharing their experiences with us, Dr. Cathy Kezelman, Mr. Chris Rule, and Dr. Kylie Bennett, and also to our Commission team members, Victor Storm and Sandra Rigby. I'd like to thank all of our attendees for taking the time to hear from us today. When we reconvene in 2023, we look forward to bringing you more on the digital mental health standards through our remaining webinars in the series. And a reminder to our attendees that accreditation to the digital mental health standards commences from 1 November 2022. We've got a list of approved accrediting agencies and their contact details published on the Commission's digital mental health webpage for scheduling and an assessment. And as Sandra touched on, our resources page, which includes the guide for service providers, the self-assessment tool, and other implementation materials. And if you'd like to subscribe to our mailing list, you can do so by contacting DMHS at Safety and Quality or via the Commission's Advice Centre. Thank you once again for joining us today.